Hello everyone, I am Dr. Parijat Ram, consultant pediatric gastroenterologist and hepatologist at Ankura Hospital. I am heading this department over last 3 to 4 years, and over this time we have made a rapid progress over treating GI and liver related problems in children. Normally we think that these are not the common problems, but over the years, as we are all seeing that gastrointestinal problems are increasing rapidly in the kids, specifically after COVID time, with the changing food, with different changing activities, so many infections there, and with the changing lifestyle also, we are finding new diseases every day. So all these problems need a specific workup, specific treatment for these kids. In Ankura Hospital, as a specialized department, we have our OPD services where we have catered more than 4,200 patients over last few years. Then second thing, many of the times these children require endoscopy. So as a parent, we get very scared when someone tells that your kid needs endoscopy. But when it is needed, it should be done. Otherwise, we may delay the diagnosis for a very long time. In our center, we are able to do endoscopy in as small as 1 kg baby when they are having some serious GI bleed or those kind of problems, to as big as 18-year-old kid. We have different kind of scopes to cater the different age group. Endoscopy setup, we have pediatric anesthetist and all the trained staff who takes care of the kid very well. And I can say with pride that over last 4 years there was complication rate of almost 0 in our endoscopy setup. Now the second thing, other than the common problems, many of the time the kids are having some acute serious illness like acute liver failure. Suddenly you find that the kid is having too much of jaundice, child is having severe vomiting, you are not able to manage at home, child requires admission. Acute pancreatitis is another condition. Severe diarrhea kind of patients. All these kids need specialized ICU care. So we have level 3 PICUs where our pediatric intensivist along with me, pediatric gastroenterologist and hepatologist, we take care of these kids properly so that they get the best management possible. Now the third category of children, I will say, there are kids who are suffering from some serious chronic diseases. They are not so sick that they need ICU admission or anything. The parents who are having these kind of problems, or the kids who are suffering with these, we know this very well, that Crohn's disease, inflammatory bowel disease, celiac disease, chronic liver diseases, these are the children who need specialized care for a very long time till the time problem is completely cured or controlled. So over last few years we are managing hundreds of these kind of patients to their satisfaction. Now comes the NICU part. There are many small babies. We have level 3 NICU in Ankura, where we see many times serious gastrointestinal problem even in infants and in neonates, like short bowel syndrome, small babies having too much of diarrhea, small babies having jaundice which cannot be managed at peripheral center, I will say, or grade 1 or grade 2 NICUs. So along with me, specialist, along with the whole NICU team, we manage these small kids as per their specific needs. Now the one more good part of our center is we have support of all very rare subspecialties like pediatric immunology, pediatric hematology. We have some wonderful pediatric surgeons. Then there is a specific pediatric nephrologist, developmental pediatricians, pediatric neurologists. So if any child who needs multidisciplinary approach, or a child is having problem with multiple organs, or a child who is over the time developing, like some rare diseases are there where different organ system get involved over the time. So you don't need to run here and there. We have a good setup. We are in collaboration with each other. We are able to provide a almost perfect care. Thank you.